want to get this out there because really people don't know who Chris Turnpaugh is, and they really should. And the reason why is, we look, Chris, you teach all across the country, even all across the world sometimes, to doctors on the subject of functional medicine and functional nutrition, not just because you have that background clinically and academically, but also you have a very unique practice. Your practice is quite possibly the busiest practice I've ever seen in the functional nutrition world. And there may be other experts in our field who spend so much time teaching and writing, they don't really spend a lot of time in clinical practice. And I've been to your practice and I've sat behind you with patients for like 12-hour shift and taken notes, and I see how busy your practice is. And I just want to just put that out there because you're not only an authority to us from an academic standpoint and as a teacher, but man, when you get an idea of something to do in your practice, you can apply it to hundreds and hundreds of people in 1 week and gather that data. So your office is really just a font of a lot of knowledge. A lot is coming out of there. And during this crisis, I'm sure you got a lot to say, and we're going to talk about that. But that's a really important point that the listeners have to understand about you. It's not just academic. It's clinical experience. And you told me stuff 10 days before it even hit the news. I mean, the whole chloroquine story, I heard that from you. I think it was like March 6th or 5th, before, maybe almost 2 weeks before it hit the news the first time. And the fact that it needs to be taken with zinc. You were the first person I heard say that. And that's always the case when it comes to Lyme disease, when it comes to all of these different conditions where people are turning away from what the medical profession is offering because it's not working and turning towards a natural approach. You're really ahead of the curve on so many of these issues. And I really want everyone listening to pay attention to this podcast or this video because, it really, if I'm turning to you, well, I want people to also turn to us in this conversation as a direction of where we're going.
I think to point that out, I do, to your point, I do teach all over. And the reason I teach is not because it's a job to teach. I love to teach. It's a passion of mine to teach. But one of the things that I like to think that I bring that may be unique is I'm in the front line. I'm in the front line all the time. I'm seeing patients. So I'm not telling you something that I read about or a research paper or something I heard about. I can't tell you how many times I've sat and because I'm still learning, we're all still learning. I'll sit there and somebody will present, this is what you're going to see. And I'm like, no, that's not what you're going to see. And I can make that statement because I actually see patients 12 hours a day, 5 days a week. And we have 11 other clinicians in the office, other healthcare providers in the office. So I get to look at 11 people's labs, findings, cases, and I get to see the most unique in my office that they kind of filter up. So I'm not the best at the marketing piece, or I haven't written 15 books to tell you how to do everything perfectly. That's not who I am. But what I am is somebody that, as you know, I'll share with you anything I know anytime. But I'm in the front lines. I'm seeing it. So I can tell you clinically that's not working or that is working. And so with that, kind of what you said is I don't know much, but I know I'm seeing patients all day long. And I can tell you what's working and what's not working. And when somebody says, I'm the authority, let me tell you, and you say, well, how many patients do you see? And they say, well, I see a couple a month or a couple a year. I haven't seen a patient in 10 years. I'm just on the lecture circuit. I'm like, that has value. It all has value, but it doesn't have value of what you see in your office. So a lot of times when I teach, I'll put up the case as far as the textbook says, this is what it looks like. And with most of my lectures, I try to put in the past 30 days, here's what I've seen. So it's not, this is my one-off case that I saw in 2004 that looks this way. This is what came in our office in the past 30 days. And by the way, this is the curveball that it threw me. It's not just the way it is in the textbook. So it's real life. It's real applicable. And so this is kind of one of we've talked about this. We want to get this message out because this is actually what comes into your office. This is what you're actually going to see. this is exactly what walked in. So.
Yeah, no, and it's interesting too because I've referred patients to your practice. You're in central Pennsylvania. It's a pretty rural type of an area. It's outside of Harrisburg, and I've sent patients from New York City to your practice 3 hours away for different reasons because some cases are very complex, and we collaborate together. And you have resources there that we actually don't have in New York City. And one of the things I remember was a patient goes, yeah, I called, and they're like, I got to wait 12 months to see him. And I'm like, wait a minute. Few people realize that there's a Turnpaugh method, and you have 11 clinicians in the office, and all of those clinicians are following a method. And you don't have to see Dr. Chris Turnpaugh to get the Turnpaugh method. And let me again toot the horn of your practice. The clinicians you have are chiropractors, nurse practitioners, but also somebody, who has a whole career in pediatric oncology, somebody who has a whole career in nephrology, and they bring their special backgrounds in primary care. But really, nobody sees a patient in your office as a clinician without first learning your method. So everyone is kind of preaching from the same book on a patient approach. So it's not like you have to wait 12 months for Dr. Chris, because you could wait 9 months for Dr. So-and-so and 3 months for Dr. So-and-so, and you're going to get, and not only that, but all the clinicians are in the same room, spending a lot of time together, and you're discussing all of the cases. So
it's pretty collaborative. So whenever, I like to call myself the escalation clause for no other reason, that when there's a question, they tend to walk down the hallway. But I have the same respect for my clinicians too, and I'll walk down and say, hey, what do you think of this? But we're very collaborative. So anybody that comes in the office, you see any doc in the office or nurse practitioner, then you kind of get a collective mindset of everybody working together.
So Chris, let's